All right, so we're going to talk hormones today.
Yeah.
My favorite topic.
I know.
Lately.
It's an important topic.
Ever since I hit my 40s, I realized how important our hormones are to our body. You know, it's one thing when you learn about it, it's another thing when you start to experience it.
Yeah, totally. Yes. The bad effects of it. Then you know how when you don't feel right, you know what it feels like to feel right, right?
Right, yeah,
Yeah.
right? And then when it happens initially, like you wonder though, right? Like, why am I feeling this way? Why am I feeling tired all of a sudden?
Exactly.
Like, why am I unable to concentrate? I feel brain fog, or even things feel like low libido.
Right.
All of a sudden.
Yes.
What the heck?
Well, everything creeps up on you. Like it starts out kind of gradual, I think.
Right.
So we think that we're okay.
Right.
Or we think that it's everybody else's problem. Right.
Yeah, we're thinking, okay, am I a little stressed out? You
Yeah.
know, maybe I'm just needing a little more water, like hydrate well, or maybe I'm not eating right. Maybe I need to take some vitamins, and things are just not improving.
Right.
I don't know. I mean, I'll tell you what happened with like what I experienced initially when I started experiencing the symptoms of the hormone imbalance. I went to my GYN, for my annual, and I told her, I was like, I'm not feeling right. I'm just tired all the time. The main thing was like no libido.
Yeah.
Like,
right.
just nothing.
Yes.
And
that affects other aspects of your life, right?
Well, yeah.
Right.
So also by like 2-3 o'clock in the afternoon, every day I was just experiencing this fatigue. Like I had to take a nap. I just had to lay down and close my eyes. And then by 7:30, I was like done for the day.
Yeah. Yeah.
I just want to sleep.
Right.
And then
yeah.
And then I wake up in the morning. I'm like, geez, like I don't feel rested.
Right.
What is going on with me? And that went on for a little while. And went to my GYN. I was like, can you check my hormones? Can you check my labs? Like something feels off. My hormones came back. My lab results came back, and I hear, well, everything looks fine. Everything looks normal. Mm-hmm. Just rest. Just eat right. Just drink. Just exercise. Okay. It's not getting better. There's no improvement.
Yeah.
Until finally, I sent my lab results to a naturopath. Mm-hmm. This is years ago, before I knew what I know now. And he looked at my labs and he says, everything looks fine except your testosterone is like so low. It's tanked.
Right. Yes.
And he's like, you just need to get a little bit of testosterone replacement. And I was like, really? I didn't even think women needed it.
Right.
Again, that was back then. So I got on the weekly injections, and then within 2 weeks I felt a difference.
Yeah.
I realized one Saturday night we were out. I realized it was like 11:30 in the evening. I was still wide awake and I had all this energy and I was enjoying. So I was like, holy moly.
Yeah.
This works.
Yeah. I noticed mine when it was like right after a breakup in a relationship, and I blamed everything on that, thinking, oh, well, it was just, like I was just stressed out and that probably made me really tired or made my libido off.
Right.
I just figured that it was something like that. And then my brother, who's an OBGYN, he had just started doing pelleting, and I went to him, and that's when this was in a different state. But when I went to him, since he had that knowledge and stuff, I was like, okay. And I started seeing and I worked for him. So I saw other patients coming in and saw what a difference it was making for them. And I was like, I think I need mine checked too, and then that's when I discovered how low I was on some major things that I really needed. And then also like now, so that's partially why I was drawn to this place, was the fact that you have the same philosophy and see the importance of how much our hormones mean. Even if your testosterone, like now, like after you get something done, it seems like it's really high, but it's what your body needs, and everybody's levels are somewhat different in how they process things. So,
but also when we're pelleting, the levels are different. Right. If a patient is on a cream or on a weekly injection, their levels are going to be different compared to
really
pellets.
Yeah.
So it doesn't mean necessarily that it's high, where as if it was like if you were doing injections or pellet or creams. we dose it differently with pellets, and the levels are different when we interpret.
Okay.
So yeah, and it's not enough, to cause aggression or hypersexuality or, facial hair growth or anything like that. It's not. We pretty much get our levels back to what they naturally would have been.
Yes.
Right.
Yeah.
When we were in our 20s or 30s.
Right.
Back to therapeutic levels.
Yeah.
If that makes sense. But, that's in regards to testosterone. But if we're talking about like estrogen deficiency, right?
Right.
And that happens at a slower rate. Like
yes.
Testosterone, once your ovaries start to slow down, or if your body's under a lot of stress, for example. Another thing is sometimes birth control pills.
Oh, right. Yeah.
Progesterone, estrogen, synthetic in the birth control pills, that can cause a suppression of testosterone in the body.
So even if you do add testosterone, then your body's resistant to it?
No, naturally it'll suppress testosterone.
Okay.
Natural production.
Right.
So there are a number of different factors that can affect the testosterone. But estrogen, that's, again, when our ovaries start to slow down. They produce less estrogen. And that's when we start to notice things like vaginal dryness.
Okay.
Some hot flashes here and there.
No sexual appetite at all. Well,
so that's more testosterone.
Okay.
But if a woman has vaginal dryness and discomfort during sex, I don't think she's going to really be interested in it as much, right?
Yeah.
The other thing is the irritability.
Yeah.
They get irritable. Everything just annoys them.
Yes.
And you know what's just really sad is like, who do they take it out on? Usually is the husband.
Right. Well, they're right there.
Right. Everything they do pisses them off. Everything they do,
and everything's usually their fault. No, I'm just kidding.
But that's why, unfortunately, it's around at that age when women are in their 40s, 50s, is when they're going through their changes, their perimenopause, they're going to menopause, and they're so if they don't optimize their hormones, they're very irritable. They get depressed. They get anxious. They can't sleep at night. They have hot flashes. They don't want anything to do with their husband sexually. Like their libido is out the window. Unfortunately, that's the time when couples end up splitting up.
Right. Yes.
And it's very sad because, it's not their fault.
Right.
They're just, their hormones are all over the place.
And that tells you how much symptoms can affect a person's life.
Absolutely.
Even if you think it's a minor thing, it's a major thing.
It is a major thing. It affects everything in our body.
Yeah.
Our brain health, our
how we
heart
respond
health,
to things.
How we respond.
They're just regular, normal, everyday things.
Right.
You're going to respond different.
Yeah, exactly. We get triggered very easily. Things that we normally wouldn't get triggered.
What are the progesterone symptoms of low progesterone?
Low progesterone, heavy bleeding. That's why also when women go into perimenopause.
But if you don't have, if you're not having cycle, then is there any other symptoms?
So if you don't have cycles, if you're low on progesterone, then that can potentially cause the lining of your uterus to get thicker. And we don't want that because then, that puts you at higher risk for developing, like uterine cancer.
Right.
Also, low progesterone means you have less of that sedative hormone. Progesterone is a sedative hormone.
Okay.
So you're going to have trouble sleeping at night.
Okay.
It's another symptom that women complain of. It's like, I can't sleep well at night. I'm having insomnia.
Or you're up and down and up and down. Right.
That's because they're low on progesterone.
Okay.
So progesterone is also a very important hormone.
Yeah.
It's important if a woman is on estrogen replacement or testosterone replacement, if they have a uterus, it's important to take progesterone. If they don't have a uterus, it's important. They do a lower dose.
Okay.
They don't need a higher. They need a lower dose again to help them with sleep.
Okay.
Yeah.
Okay. Yeah.
So it's important to go to to see a provider who is very knowledgeable when it comes to bioidentical hormone replacement.
Right.
Because we have to think about all of those little.
Yes.
All those little
possibilities of how one thing can affect another.
Yeah.
Now, like if somebody decides to do pelleting, I've heard, a lot of people ask questions about this, and this is probably a good question to answer just right here, is like you put the pellets in, and then I think people are thinking there's like a huge upsurge in all the hormones like immediately, and then it starts because they dissolve into your system.
Right.
So like after they're like does it just tail off, or is it really strong at the beginning and then it tails off to nothing? And or does it like, as long as you, like for women, if you're in that 3 months, or men the 6 months, is it like how fast does it drop off?
It's a good question. Yeah. So once the pellets are inserted, it takes 2 weeks for them to start kicking in.
Okay.
And then at 4 weeks is when the levels peak.
Okay.
And once that happens, okay, they stay, that those levels stay at that, that peak for about 2 to 2.5 months. And then it slowly starts to go down.
Okay.
That's why it's important, I have my patients, when they're pelleted, I have them schedule their next pelleting appointment before they leave.
Yes.
Okay.
Yeah.
Because, over time, those pellets dissolve.
Right.
And at the 3-month mark already, their levels are going to start to decrease.
Right.
And they'll start to feel.
Yeah.
They'll start to feel it. Like I got my pellets.
To avoid them to stop. To avoid people from hitting that wall.
Right. You don't want to. Yeah. You don't want to get to the point where where your levels are so low and you're feeling it. You're feeling the symptoms again, to get pelleted, because now you have to wait another 2 weeks
to make it. So it's like a month before you're going to start even feeling like yourself again.
Exactly.
Right. Yeah.
So, like I got my pellets inserted. That was what, mid-June, right, Leah? When was that? Mid-June or beginning of June? Beginning of June.
Yeah.
So it's been 3.5 months for me. So I started feeling the burn off like 2 weeks ago.
Right.
I just haven't had time.
Right. Yes.
We didn't have we had to coordinate our schedule for Leah to pellet me.
Yes.
So I started feeling it.
Yeah.
And the thing is, when my estrogen levels start to decline, I feel more inflamed. Mm-hmm. I feel more. It feels like you're bloated, but really that's inflammation.
Yeah.
Like my waistline, I just feel like, what else? The vaginal dryness starts to occur. And like my energy levels start to go down a little bit.
So even estrogen helps raise your energy levels too.
Well, the testosterone. Okay. Because I have testosterone.
Yes, me too. Well.
Right. So
I love it.
I started to notice, like, okay, it's time to repellet. So I got my pellets in today. I'm excited. Finally.
Yeah. Right. Exactly.
Yeah.
So is your husband. Right.
I think everyone in the family, benefits from that, because mom is in a better mood.
Yes.
Mom has energy. Right. Mom is motivated. Like, I want to go out and do things.
Right.
I want to go out and be more active. It's like I'll come home from work and I feel like an energizer bunny.
Right.
I still have all this energy.
Yes.
To cook, to tidy up, to go out somewhere, to do something with the kiddos, with the husband.
Exactly. Yeah.
And then come home and give my husband some attention.
Right. Yes. Yeah. Not just go straight to bed.
Yeah. Right? So everybody benefits from it.
Yeah. Definitely. Yeah.
Also, just you're more productive.
Right. Yes.
You're motivated to do things.
It's nice to have your life not have to slow down because of how you're feeling.
Right.
And how it affects everybody else, because you don't even realize how. We don't always realize how much our own actions can affect somebody else. Like, even if I have like a crabby person that I am at the gas station around, I keep thinking, man, maybe they need their hormones checked. Right?
Oh yeah. Oh, absolutely. Right. Yeah. I can, I can tell when someone is low on their hormones, men and women. Yeah. Just by looking at, like, how there's men who are like, their extremities are like thin. Yeah. A little thin, but then they have this beer belly. Right. Right. Yeah. So that's indicative not just of a testosterone deficiency, but also an estrogen deficiency.
Yeah. Really, of estrogen deficiency. I would have thought that the estrogen would have even gone up. If they're having, No,
if they're low on testosterone, their estrogen levels are lower too. I mean, men need estrogen just as much as women do, but they just need them in lower levels. Right. They don't need them as much. It's just like they need testosterone at higher levels. Right. We need them at lower levels. Yes. But it's important for men as well, for their heart health, bone health, for their mental health. Mm-hmm. When someone is low on estradiol. Right. what can happen over time is, like how our skin is affected.
Yes.
Like our skin starts to say, we lose that elasticity, right? Well, the same thing happens with the blood vessels.
Yeah.
You're familiar with the term atherosclerosis?
Yes.
Hardening of
the
because,
arteries.
Right.
Yeah.
When you have low estradiol levels, your arteries, your vessels start to harden.
Okay.
They're not as elastic as they should be.
Right.
Okay. So that's why I can't stress enough how important our hormones are to our body.
What about like bone health? How does it affect? Does it affect bone health too? Just the same?
Have you heard of osteopenia, osteoporosis?
Yeah.
So.
Right. I was like knowing women right at this age.
At what age do women get
bone
density diagnosis of osteoporosis? It's usually after menopause,
exactly.
right? 50s, 60s, 70s. Why? Because they're low on estrogen.
Yeah.
Their estradiol, it's very important for our bone health.
Yeah. So for people that have never, what age should somebody start looking at this? Like, you don't have like 20-year-olds that are like,
it's very rare.
Issues.
Actually, my mentor and the doctor who I trained with on hormone replacement therapy, she actually started to go into perimenopause very early. She was in her late 20s.
Oh, wow. Wow.
And she did not understand what was going on with her. She was suffering. Her doctors could not help her, couldn't figure out what was going on. Finally, she realized that it was a hormonal imbalance. And that's what then
drew her to her business.
Business, yes, and to specialize.
Right. Yeah.
She's here. She's local.
Right.
And she's called the hormone doctor.
Yeah. Right.
So
I'm just saying, like, for people who are ever watching these things, like, just because you are 28 doesn't mean that you couldn't still be suffering from the same thing.
Of course.
And the doctors aren't usually going to look at it because they're going to be like, oh, well, they're only 28 years old. They don't need to worry about it yet. But
especially nowadays, I feel like with our lifestyles, everyone's on the go.
Yeah.
Everyone's high stress. Also, the environmental factors we have to take into consideration, right? Endocrine disruptors, using things like just the chemicals in our laundry detergent, household products,
processed foods,
drinking from what we shouldn't be doing water bottles, water bottles, plastic.
Yeah.
All of these things affect our endocrine system, affect our hormones. So, I mean, I've seen cases where women are as young as 30 or early 30s, and their hormones are out of whack.
Right. Yes. Yeah.
So we need to, we need to help them. Not necessarily, at that young age would I right away go into hormone replacement.
Right.
We kind of have to dig even deeper,
find out
and see what's the root cause of that.
Yes.
Address that, and then try naturally some options that can help boost their hormone levels up.
Yeah. I know that, like, I've heard this before, and I could be wrong, but I heard that, like, there's, like, certain ages that they expect young, like, girls to start their menstrual cycles, for instance, and I think for African American girls, it's at a younger age than it is Caucasian, but what happened is, like, there was, like, a base age that they were like, okay, if it was like age 8, I think, for girls, if they had a period before age 8, that they would have to, the doctors would have to be concerned about looking at their longevity of reproductive cycle, like how long are they, and so they could be going through menopausal early when they're like in their 20s instead of, so it could be even
absolutely
people that have,
when a female is developing in utero, that's her ovaries are developing, and the amount of eggs that she's going to release throughout her lifetime. All of that happens in utero. Right. So if a girl starts a period at 8, so every month now her ovaries are releasing an egg. Right. So absolutely, she's going to go into menopause early in her life. Right. And her fertility. Right.
Is on a different time clock.
Absolutely.
An earlier time clock.
Absolutely. Yes. Yeah. Okay. And in those cases, if they go into menopause early in life, it's even more so important for them to get on hormone replacement therapy. Yeah. Because now, life expectancy for men and women, it's longer than what it was, 100 years ago.
Right. Yes.
Right?
Yep.
So imagine a woman going into menopause at the age of 35, right? But she's going to live her life, let's say, till she's 75, 80.
Yeah.
So that's half of her life that she's going to be suffering.
Exactly.
Right? And then she's going to develop, because, if you're low on hormones, if you're not optimizing, that puts you at higher risk for developing diabetes, hypertension, hypercholesterolemia, obesity, arteriosclerosis, heart disease, osteoporosis,
all of those things.
So now, they're living their life, they're getting older, and they're developing all of these health problems.
Yes.
Right?
Yeah.
And it's that, what kind of quality of life is that?
Right. Exactly. Yeah. And if there's something that can be done.
And not to mention the psychological effects. Again, anxiety, depression, the insomnia.
Yeah. Yeah.
That's not fun.
Exactly. Right. If life isn't tough enough. Right.
Right. Exactly. So, that's why I was very much inspired, by this doctor's, just her story, what she went through, and how she was able to, honestly, just helped herself.
Yes.
Just did the research.
Did her own research.
Exactly.
Yeah.
And then I realized I had a testosterone deficiency, and I was like in my mid to late 30s.
Yeah.
And I was always able to lose weight. Like if I had a party, an event, vacation, something, I needed to fit into it. Yeah. I could lose 5 pounds like this within a few days.
Yeah.
All of a sudden, I'm like, geez, like I'm putting on this weight, and it's right here.
Yes.
My mid-abdominal.
Right.
Section. Like I'm putting on weight, and it's so hard to get it off. It's just so stubborn.
Yes.
So I didn't know at the time that was one of the symptoms of a testosterone deficiency. You gain weight, and no matter what you're doing, you can't lose it.
Right.
And you're working out, you're lifting weights, but you're not seeing the results.
Yes.
You just can't build muscle. You can't lean out. You can't tone up. So once I figured that out, and I got on the hormone, the testosterone replacement, I felt so much better.
Yes.
It was like a night and day.
Right.
I got so excited about it. I just started telling my friends, my family, anyone who I thought that could benefit, like, check your hormones, see what's going on. And I got a lot of my friends then on testosterone replacement.
Right.
And till this day, they're like, Naomi, God bless you. Like,
no kidding.
What a game changer.
Yes. So about men, I'm thinking, like, I think sometimes men feel like when they are having low testosterone that they feel like sometimes they don't want to get things checked out because they're like worried that it's going to make them feel like less than a man because their levels aren't like super high.
Right.
But I know some of the most manly men ever in the world that they didn't even know their testosterone was low.
Yep.
Until like it's not even like symptomatic. It's just like, okay, well I got to go do labs because that's what guys do. And so they went and get their stuff checked, and they're, what? My testosterone's only like 30, or something like that. I mean, but it happens. Like it is ridiculous how, but that doesn't make a man less than a man. It just makes their hormones out of whack. And then they don't realize sometimes because they're stubborn, they don't want to get it checked out.
Either they're stubborn or they just think that they're feeling normal. Right.
Yeah. Yeah.
So I see this all the time. Men come in,
and even young men can have major issues.
Yes, yeah. I have treated young men even in their mid to late 20s.
Yeah,
unfortunately, but it is a thing, where men start to, like, their energy levels are a little lower than usual. Still come home from work, they'll have their dinner, and then they're just sitting on the couch watching TV or just scrolling on their phones.
Yeah. They just feel more tired. They don't know why.
Tired, right. And then, their libido also starts to go down. There's, their libido slows down. So, and they think it's normal.
Right. They just feel like they grew out of that phase or something.
Right. But, you also start to see men who start to get a little moodier, or they get a little more, like, easily frustrated or irritable, or
cry easier,
right? And you were like, what the heck? But because the hormones are also affected.
Right.
The problem is like with men think that testosterone is a sex hormone.
Right. Yes. Because that's what they notice
more
first,
to it.
Right.
That's why I feel like sometimes women have it's a challenge for them to bring that up to their husbands when like a woman is noticing that her husband is, maybe gaining some weight. He's not as active as he used to. He's not as motivated as he used to. Also their sex life is affected. If a woman brings that up to her husband, that hey, maybe you should go check your hormones. Sometimes men, they get defensive.
Right?
Like, no, I'm fine. Everything's fine.
Yeah.
But that's why I tell women, when they reach out to me with this concern, I tell them, you have to bring it up differently. You have to bring it up where testosterone is important, again, for a lot of systems in our body. Your heart health, again, your brain health, your bone health, okay? So bring it up like that. Like, check your hormones, because I want to make sure that you're
related. Instead.
I want to make sure that your health and your wellness is optimal.
Yes.
Okay. It's not something that's normally checked, but if you go to your annual exam, they'll do the basics, your complete blood count, your CMP, they'll check liver, kidney function, they'll check, your glucose levels, cholesterol,
cell counts.
They won't check hormones unless you ask them to.
Right. Yeah. Yeah.
And that's unfortunate.
Yeah.
That's what we do. That's what we do, like a full, complete panel to look at the full picture.
Yes.
What is going on. I have a patient, he started coming to me about 2.5 years ago. He was overweight, high cholesterol, A1C was elevated, and he was in his mid-40s. Okay? His wife dragged him in. She made him come because he kept saying, I feel fine. Everything's fine. I feel normal. There's nothing wrong with me. I'm just here because of her.
Right. Yes.
Okay. Yeah. Well, I mean, thank you. That's important to take your wife and, take her concerns seriously. So we did a set of labs, and again, indeed, his lipids, everything was elevated. His testosterone levels were low. Okay. And the nice thing about him is very compliant. Yeah. So he told me, okay, tell me what to do, and I'll do it.
Right.
Okay. He followed my instructions to the T. Whatever supplements I told him to take, he was taking. He was coming in every week to get his testosterone injections. He was doing everything I was telling him to do. Okay. 3 months later, we checked his labs. They were improving. Oh, one more thing. He mentioned the first time I saw him was that when he would wake up in the morning, he felt like his whole body was hurting. Yeah. His joints were like, everything was hurting. And he just thought it's just part of, the aging process. Yeah. He's in his 40s.
Yeah.
It's okay.
I'm in my 40s now. I'm middle age.
Right. So 3 months later, we do his follow-up labs, and I ask him, so how are you doing? How are you feeling? And he says, you know what? I realize now what normal is supposed to feel like.
Yeah. Oh, that's great. Yes.
Isn't that crazy?
Yeah. And so it changed. And did he slim down or?
Oh yeah. 3 months later, he did lose some weight. He had more energy. Right. His lipids, A1C went down. His libido improved.
Good. So
his wife.
So happy wife. Right.
Now he's slimmed down a lot.
Yeah.
Now 2.5 years later, slimmed down a lot leaner. Again, you can just tell by looking at a person
age backwards. Right.
Exactly. Right. Well, again, hormone replacement therapy is part of anti-aging. Yeah. He just looks happier overall. Right. Healthier, happier. He's just.
You have the energy to smile at people. Yeah. That is kind of a thing. You do feel so exhausted sometimes. You're like, I don't even feel like pretending. But like.
Exactly. Yeah. You just want to be left alone.
Yeah.
Just veg out on the couch and watch TV and like fall asleep in the evening. And that's, but that's, what kind of quality of life is that?
Yeah. What kind of life? Yeah.
Fun.
Right.
Yeah.
I agree.
So I'm really grateful, honestly, that like from my experience, even though it wasn't fun, having to experience that at the time. But I think there's a reason for it. I feel like
you can identify.
I can relate. But that's also what inspired me, like to learn more about it. Right. And to specialize in this.
Yes, and have such a need of being able to recognize that to help other people.
Yeah. Like when I optimize my patients' hormones, they come back and they're like, oh, I feel great.
Yeah.
I'm working out.
Right.
I feel better. My brain is functioning. My mental clarity has improved. My relationship, has improved. Like,
yeah.
I swear, I just want to get up and do a freaking happy dance.
Yes. Yeah.
This is like literally what I live for. Like what I look forward to every day.
And there's such a need for it, and it's great that I love working here because I love seeing how you help people too. So you do a great job.
I love having you here.
Right?
But yeah, so I felt like it's important. Like we have to talk about this. We have to create more awareness.
Yeah. Right. Yes.
People need to know.
Yeah, and if there's any questions, people you do a great job of answering questions for people too. So like if they are wondering about stuff, they should just let us know.
Yeah, and I'm happy to answer questions. No question. I think no question is a silly question. Like, send me your questions, any concerns, any questions. I'm happy to address them. I'm happy to answer. Again, because it's very difficult, when you, unfortunately, right now, current moment, traditional medicine, they don't even recognize the fact that a woman needs testosterone.
Yeah, right.
They don't. Oh, so that's why,
if you go with just certain, if you're not looking at any,
if a woman who's in menopause goes to her doctor and tells them that she's fatigued and she's depressed and she doesn't have the motivation to do things, they'll just put her on antidepressant.
Yeah.
Unfortunately.
Right. And then you've got a million other problems.
Right. Where,
right.
Yeah. And that's it, the easy fix is just optimize the hormones.
Yeah, exactly.
Everything goes back to normal.
Yes, absolutely.
So yeah, so anybody who's watching us and anyone who's interested, again, if you have any questions, if you are experiencing some of the symptoms that we mentioned, that we discussed, let us know. Reach out to us, DM us. We're happy to help. I mean, we've been there, done that, right?
Exactly.
We're on the same boat. We know what it feels like.
It's life-changing for the good when you get it corrected, for sure. Yeah,
absolutely. For sure. Yeah, so I think it was a good chat. I'm glad I got my pellets today, and I felt inspired to just just talk about
your whole family, and all of us are happy too.
Yeah, right? Absolutely. Well, wishing everyone a happy Friday, and enjoy your weekend. And I guess we'll see you guys.
We'll see you
in
later.
the next few days, next live. All right.